All right, let's dive into this case. What we have here is a chest radiograph of an infant. Given the absence of visible proximal humeral epiphyses, it strongly suggests that this is a neonate, likely premature. The presence of a nasogastric tube in what appears to be an appropriate position further supports this. Looking closely, the lung volumes seem reduced bilaterally, and there's a diffuse granular appearance throughout the lung fields, which is accompanied by multiple air bronchograms. Importantly, there's no evidence of a pneumothorax or pleural effusion, and the cardiothymic contour appears normal. Now, if we're dealing with a premature neonate, the first thing that comes to mind is respiratory distress syndrome, RDS. However, it's crucial to consider other possibilities. For instance, the appearances could also indicate transient tachypnea of the newborn, TTN, especially if we're talking about a term baby. Another possibility could be diffuse pneumonia, particularly if the baby shows clinical signs of sepsis. The key here is understanding the context and correlating the radiographic findings with the clinical presentation. When interpreting neonatal chest radiographs, gestational age is critical. RDS is most common in premature neonates, while TTN tends to occur in term neonates. Meconium aspiration syndrome is another important differential, typically seen in term or post-term neonates, often with increased lung volumes due to air trapping. Observing air bronchograms is particularly helpful. They are not typical in meconium aspiration, but are quite prominent in RDS, leading to airway distension. It's also vital to keep an eye out for complications like pneumothoraces, which can arise secondary to meconium aspiration or complications from intubation, and pleural effusions, which are more common with meconium aspiration. Don't forget to assess the cardiothymic silhouette carefully, and examine the heart and pulmonary vasculature for signs of congenital heart disease. These are key elements in a comprehensive evaluation. Moving on to respiratory distress syndrome, RDS, which is sometimes referred to as hyaline membrane disease or surfactant deficiency syndrome, this condition is primarily seen in premature neonates. It usually presents within the first few hours after birth due to the lung's inability to adequately expand. The radiographic features include low lung volumes unless the infant is intubated, and a diffuse granular or reticulogranular shadowing that can become confluent. Air bronchograms are a significant finding here, often spontaneously resolving within 7 to 10 days. For intubated infants, it's crucial to watch for complications, such as pneumothorax or pulmonary interstitial emphysema. So in summary, this case presents typical features of RDS in a premature neonate. However, the differential diagnosis also includes other conditions like TTN and meconium aspiration syndrome, depending on the clinical context and gestational age. As always, thorough clinical correlation is essential to ensure accurate diagnosis and appropriate management. If you're enjoying these in-depth analyses, don't forget to subscribe to Radiology Made Easy for more insights and case studies.